Take me away from home. Show me all the.
Hello there, this is Dr. NAMBI. Today we are coming in with our continuation of our health series, and this week, as I said, in the coming few days or weeks, we will still be touching on health topics. So don't forget to just comment below and give me your suggestions on what topic you would like me to cover, especially when it comes to your health related matters. So as you know, my name is Dr. NAMBI. I'm the sole owner of Dr. NAMBI Surgery, which is based in South Africa. So this week we're just going to be touching here and there on our health related topics, and the first topic also I would like to touch is your vaginal discharges, which is more of your woman health. Before I continue, if you haven't subscribed on my YouTube channel, please go down below the page and subscribe onto my YouTube channel, and don't forget to hit the notification bell so you don't get to miss any of the topics that we are going to be covering in the coming few days. So let's get right into our topic, which is vaginal discharges. So with your vaginal discharges, the topic is actually very, very broad. But I just thought, let me start with the most common one that most patients present with, which is your bacterial vaginosis. So you might ask, what is exactly vaginal discharges that is caused by bacterial vaginosis? So like the name says on its own, it's a vaginal discharge that is caused by a bacteria type of infection. So most of the times what happens, the good bacteria outnumbers the bad bacteria inside your vagina, and in that case it results in what we call bacterial vaginosis. And the symptoms are mostly often you see them after having sexual intercourse, especially if you haven't used condom or protection. So most women will present with burning of urine, low abdominal pain, itching around the vulva or around the vaginal area, and some women will also present with a very offensive or fishy type of vaginal smell. And so those are the most common symptoms. Some patients might also have your urinary symptoms like your burning of urine, painful urination, and then we know obviously this might be a bacteria type of infection. So those are your symptoms for your bacterial vaginosis. The treatment, usually we give you your Metro V gel, which is a gel that you put inside your vagina. It's designed that you use it in the night for 5 days. After 5 days, you usually stop the treatment. So you apply it in the night. In the morning, you take your normal shower or you take your normal bath, and that's about it. And then also your local doctor will prescribe your metronidazole, oral antibiotics to also clean that bacteria discharge. And then you might also ask, what is the commonest cause of your bacterial vaginosis? Most of the times we've seen women who use perfume bubble bath or perfume soaps. They are most commonly are the ones who present with this type of problem. We've seen also women who use scented panty liners. They also present with this problem. We've seen women who use, this douching or products that they put inside the vagina. So that also can contribute to your bacterial vaginosis or your imbalance of bacteria inside your vaginal cavity or outside your vagina. So those are the most commonest causes. So we always recommend that you don't use any scented products around the vagina, because the vagina already cleans itself. You don't have to put anything, just plain water, that's enough. All right, so we've spoken about the symptoms, we've spoken about the causes, we've spoken about how do you treat it. And then you might ask, what are the complications if I don't go and check up with the doctor? Most of the times the complications with your vaginal discharges, especially your bacterial vaginosis, is you get what we call a PID or pelvic inflammatory disease. So because of the recurrent infection you are most likely to be prone to be having a pelvic inflammatory disease, which is caused by recurrent infections, infections from your UTIs or infections from your bacterial vaginosis or vaginal discharges. The other complications that we commonly see is that, women can present, especially those who are pregnant, they can go into preterm labor. Preterm labor is just when you deliver before you, let me say 40 weeks pregnant. But these ones, they usually deliver way before. So way before, your 36 or your 34 pregnancy gestational age. So it can be risky in the long term. So we always say, please, before concluding and going, and thinking this is nothing serious, I would recommend go to your normal GP, let your GP or general practitioner check it out, let them start you on treatment. If they say everything is okay, then you can relax. And then my top recommendations when it comes to vaginal discharges or your vaginal bacterial vaginosis is always as a woman, number one thing you must do for yourself is to always have a PAPSMEAR. At least have once a year you have a PAPSMEAR. A PAPSMEAR is just a test that we do. We use a speculum, we go into your vagina, and we are able to actually, take some swabs with, a brush, a speculum or a brush, and then we take that, we send it to the lab. It will be able to show us if this vaginal discharge is a bacterial type of vaginosis. Is it caused by your candida infection? Is it caused by, your HPV, your human papilloma virus, which might be also leading you to having, your cervical cancer. So it helps us to be able to pick up even the cancer very early. So as a woman who is sexually active, please, we always recommend go as early as possible, have yourself checked out, ask your midwife or your nurse, your doctor, just to be able to do this basic test for yourself, because you will be thanking yourself in the long term if you do that PAPSMEAR. Also, if you are, like I said, in a sexual relationship, always be open with your partner. Talk to your partner if you're experiencing lower abdominal pain, burning of urine, vaginal discharge that is, a little bit offensive or of an abnormal, smell. Please talk to your partner so that your partner also can get treatment. We've seen women, they will come, they'll get treatment, but the partner never gets treatment. In that way, when they go back to their partner and they don't use a condom, again, the infection still continues to come time and time again. So please be able to speak to your partner so that your partner also will get also treatment. The other thing also is to always talk about your contraception with your doctor, with your partner. It's very important, like I said always from the beginning, this is a vaginal discharge that you usually get because of unprotected sex. So the first thing we will recommend is to use a condom. A condom will help you to prevent, your STIs, to prevent your HIV and any other, diseases that might be related to your genital area. So please, speak to your partner, speak to your doctor so that you already start on a proper contraception. And not forgetting also, don't forget to do your HIV test, don't forget to do your hepatitis test, your STI profile, your syphilis and all these other tests. Please, before you even start on that journey of being sexually, active, know your HIV status, know your syphilis status, know your hepatitis B status, because that will help you in the long term, especially if you are, in an active sexual relationship. That will help you on a long term. So I hope this information has helped you a lot. Don't forget to like, to subscribe and follow me on YouTube. I'm also available on Instagram and Facebook. You can find me, look for me at From Ghetto to Dr. Premier. Thank you so much.